available, how people can identify it, the symptoms and everything that goes with it, how people living with the disease can actually enjoy their life and also live it to the fullest. I'll be back.
Hey, stop! You little man. Just see.
Secure pill. Now, secure pill is a low oral contraceptive pill taken daily by women to prevent unintended and unwanted pregnancies. It's safe, it's easy to use, and giving many women the option of planning their families for over 30 good years. Provides a modern woman the opportunity to have autonomy over her reproductive life and a convenient way to plan her lifestyle. With secure, you decide. This morning we are looking at sickle cell. My guest here, she's not a stranger, she's been here a couple of times. She's Sharon Mills. She's a pediatrician with Cradle. Dr. Mills, good morning.
Good morning.
It's
Thank you
good
for
to have
having
you
me.
here. You're
Thank you
looking
for having
lovely.
me. Thank you.
Yes. Sickle cell, to a lay person, how would you break it down for the person to understand what this disease is?
Okay, so when we talk about sickle cell, it's a group of disorders, a group of conditions that affects the red blood cells. And the main issue is with the hemoglobin. Hemoglobin is what carries oxygen around the body, and it is contained in the red blood cells. Sorry. So normally, each individual gets two hemoglobin genes. The genes are what cause the production of the hemoglobin, and one gene is gotten from the mother and the other from the father. And most individuals have the hemoglobin AA. So when you have hemoglobin AA, that's the normal hemoglobin which carries oxygen around your body. But if you get an unusual hemoglobin from your parents, usually the hemoglobin S, that's what causes sickle cell anemia in most patients. Another common hemoglobin is hemoglobin C. So a lot of the time, if two individuals have a child and they are both carriers or they both have the hemoglobin AS and they have a baby, with each pregnancy, there's a 25% chance that that baby will have sickle cell anemia, which means they usually have hemoglobin SS.
Okay.
Okay.
Can you please say that again? I didn't get it.
Okay. So let's say you and your husband have a baby, but you are hemoglobin AS, and your husband also has the two hemoglobin genes, A and S.
Okay.
When you have a child, there's a 25% chance that each child you have will have hemoglobin SS.
Okay.
So if you have hemoglobin SS, that's the most common sickle cell disorder we have.
And the other types as well.
Other types as well. But hemoglobin SS is the most common one, and that's what we call sickle cell anemia.
Okay. You're saying anemia. Sometimes I hear disease. It's the same thing.
So sickle cell anemia is the whole group. So hemoglobin SS, hemoglobin SC, hemoglobin SD. Sometimes we have other combinations like hemoglobin S beta thalassemia. I know it's a lot of information. Sorry. But sickle cell disease refers specifically to the two hemoglobin SS. So if you have hemoglobin SS, you have sickle cell disease. Okay. So they can be used interchangeably, but hemoglobin SS is specifically sickle cell disease.
Okay. Okay. Sometimes people refer to it as, okay, I have the trait and I'm a carrier.
Okay.
How do you put that?
Okay, so if you have the trait or you're a carrier, in the example I gave, that means you have one normal hemoglobin, which is the hemoglobin A, and then another abnormal hemoglobin, which could be hemoglobin S or hemoglobin C or hemoglobin D. And with that, individuals who are carriers don't usually have symptoms that
So that's the
individuals with
AS.
AS,
The carriers are
the
the
carriers,
AS.
yes. So they don't usually have the bone pain. They don't usually get anemic like individuals with sickle cell disease or sickle cell anemia have. So that's the
difference.
yes.
Okay. Let's look at the symptoms or the signs. How would you know that, an individual know that, okay, this is what I have, so I need to take care of myself?
Okay. Right from the beginning, it's important to know what your sickle cell status is. And a lot of the time, it starts from infancy. Children who are below 6 months will not usually have any symptoms because, unlike in older children and adults, children have a different type of hemoglobin. They usually have hemoglobin F and then hemoglobin A as the dominant hemoglobin. So as they grow older, then it changes and then they may start having symptoms. But infants as young as 6 months or 9 months may start having bone pain. With children, it's difficult to tell when they're in pain. They may just manifest this by crying. So they may be irritable, cry a lot, especially when they are carried. So that could be a sign. And sorry, apart from that, because the red blood cells break down frequently, the individuals who have sickle cell anemia also tend to become anemic. So they may have get tired easily when they play or when they are doing certain activities. You may also notice that they look pale. So if you look underneath their eye or their palm, they look paler than you and I might look. And because of the abnormal hemoglobin, normally red blood cells are able to pass through the blood vessels and then supply the body organs or tissues with oxygen. But because of the abnormal hemoglobin, this ability of the red blood cells to conform and change their shape so that they can pass through the blood vessels is lost. When that happens, they may block the blood vessels to these organs, and that's what causes the pain. Because if your blood vessels are blocked, you're not getting the oxygen that you need. Your body will react by being in pain. It's a defense mechanism. It's a sign of inflammation. So that's another common sign they have bone pain, and that's one of the most devastating things patients come in with. That aside, individuals with sickle cell also have increased risk of infections, and this because their immune system has some regulatory issues, so they may not be able to fight off certain infections as well as individuals who do not have sickle cell anemia do. So commonly they may come with a fever, they may have the pain, they may have symptoms of anemia, and those are the common things we usually see in patients with sickle cell. Yes.
Okay. You made mention that below 6 months, babies don't really have any of these.
Yes.
So once you know you both are AS, and then you have a baby, it means there's 25% chance of your baby being. So when the baby is due, is it part of the newborn screening for you to know, or you just assume, okay, I know 25%, so let's go and do the test on our own, and then we can tell this our child has it.
Okay, so each year there are about 15,000 children born in Ghana who have sickle cell anemia.
Wow, and 15,000.
Yes, thankfully, newborn screening for sickle cell anemia is available at, I know, mainly at the two main teaching hospitals. So at Konfanoche, they started a while ago, and also at Kolebu Teaching Hospital. So because of the high incidence in our society, usually all newborns who are delivered have the newborn screening done. And it's a simple heel prick test. So a small injection is given to the heel of the baby's foot. A blood sample is taken, it's run at the lab, and then the results are made known to the parents. Okay. If this is especially important if the parents have sickle cell traits. Yeah. And if it's detected that the baby has sickle cell anemia or sickle cell disease, they are usually enrolled into the hematology or the sickle cell clinic, and they are followed up. So they are usually started on medication to try and reduce the incidence of them having these painful crises, of them having anemia. They are started on medication like folic acid, vitamin C, zinc, COVID. And then usually if they are at about 9 months, the parents are given the option of starting the children on a drug called hydroxyurea.
Which they
Hydroxyurea,
were going to be on for life.
usually, yes, they are on it for life. In some jurisdictions, there's the option of doing a stem cell transplant, a bone marrow transplant, which could alter the genetics of the individual so that they no longer have sickle cell anemia. But it's not widely available.
Okay.
So what we usually do is start them on the micronutrients, give them the option of starting on hydroxyurea. And hydroxyurea increases the amount of fetal hemoglobin. Remember, we said that the young children don't usually have symptoms, and that's because they have dominantly the fetal hemoglobin, hemoglobin F. So hydroxyurea aims to increase the concentration of this in the individual's blood. And by doing this, it will decrease the chances of them having the painful crisis, decrease the chances of them having anemia. Because there are so many complications that can occur from sickle cell. So as much as possible, we want to take steps to halt the complications before they can occur.
Okay. As 15 minutes at the top of that, I have here Dr. Sharon Hannah Mills, pediatrician from Collywood, discussing sickle cell. Sure has been made possible by Secure Pills. With Secure Pills, you decide. Our phone lines have been opened. Number to call is 0540 130 684. 0540 130 684. It's the same WhatsApp line. Drop us a WhatsApp message and then we are going to go. Dr. Mills, I want to find out sickle cell and pregnancy. Once the woman is pregnant and she has sickle cell, how different is her care from when she's not pregnant? Let's pick this call. Hello, good morning.
Hello.
Great, good morning. Your name, where are you calling from, please?
Uh, my name is Eric, calling from industrial area.
Eric, can you turn on the volume of your radio? There's a feedback.
Yes, please. My question is, I have a 6 month old baby, and I wanted to know if I wanted to know her physical status. But I called some labs around, and I was told the baby is too young at 6 months. I wanted to find out from doctor at which hospital can I go to have it done.
Okay, thank you so much, Eric. Thank you. Yeah. So the baby is 6 months and he wanted to know the baby status, but he was told that baby was too young. And where can he get help? Because you had mentioned that this is done, there's a newborn part of the screening. Where can you go so that you can be able to know the baby status?
Okay, so the lab test can be done at Kolebu. Usually, because of the fetal hemoglobin, we want to wait a bit before we do the HB electrophoresis, which will determine the two main types of hemoglobin that the baby or the child has. But it can be done at Kolebu Teaching Hospital. I know that it can be done at Lancet as well. There are certain labs that can do it. So,
Okay. So anytime after 6 months?
yes, please.
Okay. Okay, you can. Before the call came, I wanted to find out when the woman is pregnant. She has sickle cell and she's pregnant now. How different is her care now from when she wasn't pregnant?
Okay. We know the things that generally cause the painful crisis in individuals with sickle cell. So, for instance, like each pregnant woman, she'll still need to take in a lot of fluids. If she has sickle cell anemia and she gets dehydrated, there's an increased chance of her having a crisis. She's also at increased risk of anemia. Usually, pregnant women have an increased risk of anemia because they are providing not just for themselves but for their babies as well. But in this special situation, because her red blood cells are already at an increased risk of breaking down because of the hemoglobin S, will usually have to monitor her blood levels or her hemoglobin levels when she's pregnant to make sure she's not getting anemic. And if she is, she may need to receive a blood transfusion or have certain medication to help boost her hemoglobin levels, which she can take orally. All pregnant women are usually given folic acid and some sort of iron supplementation. But it's especially important for women who have sickle cell to take these medication regularly. And of course, they have to be regular with their antenatal care as well. It's important to visit your doctor even if you feel like you are well, because there are certain complications that can occur and may be triggered, especially because of the pregnancy. And in our region, malaria is too common. And it's important that even though it may be uncomfortable because of the heat or whatever, women who are pregnant and have sickle cell especially need to sleep under an insecticide treated net. And during the pregnancy, all women are usually given malaria medication to prevent malaria. So it's important that they take these medicines as well. Okay.
With the malaria, somebody mentioned that once you have the patients, they don't get malaria.
Who does patients
Like
with
sickle
cell?
cell. Is it true?
It's usually individuals who have the sickle cell trait, and that's
Okay.
another reason why it's so common in our environment, because malaria is so common
Very
here.
common.
So
Very
it's
common.
it's a sort of adaptation that if you have the A and S, you're usually not as likely to get malaria as someone who is AA. But they do get malaria, but not as common.
Not as common. Okay. You made mention of the pain. Does it mean are there some triggers?
Yes.
Yes. Let's talk about the triggers.
Okay. Apart from getting dehydrated, like we spoke about, sometimes when the weather is very cold or even very hot, it can trigger the pain crisis. So as much as possible, if it's cold, individuals with sickle cell are advised to try and keep warm. They're advised to drink a lot of water. I deal with children, so usually we'll tell the children to drink a certain amount a day, depending on their age and their weight and what they're able to drink. Another trigger is infections. So that's why it's so important that we try and prevent malaria, because a lot of the time the children will come with malaria, the fever, they are not eating, they are not drinking. That can trigger a pain crisis. It can trigger anemia. It can trigger so many things. And apart from those three main things, certain things, even such as stress, psychological stress, can sometimes trigger pain crisis.
So I have this question here. It's from Aaron. It says, what are the possible grounds or conditions that someone is exposed to that can lead to that person getting sickle cell anemia?
Okay. The main thing is that it's an inherited condition. So if you get the abnormal hemoglobin genes from your parents, that is what causes sickle cell anemia. There hasn't been any other studies that show there's something else which causes. So that is the main thing. It's an inherited genetic condition. So you get it from your parents.
Okay. For this year, I know the theme how to take care of yourself. I had a conversation with someone who actually has sickle cell. He came to our office on Monday and he told me he didn't have a problem telling me because he said this sickle cell month, so I need to create more awareness. And he got to know he had it when he was 14.
Okay.
I think he said it was a doctor who told him that the mother needs to tell him something.
Okay.
He was going through the crisis. Ideally, when do you think parents should tell the children that they have it?
That's a difficult question. I think each child is different.
It's different.
How they process things. Every child is an individual and should be treated as such. So once you start coming to the hospital with your child, they are naturally inquisitive. Usually around 4 or 5, they'll start asking you questions. Why are we going here? Why am I taking this? Why do I have to do
Especially
this?
when the other siblings are okay.
Not,
Because this guy
exactly.
has other siblings who are AS, but he's
the only
so
one.
he was the only one going in and out of the hospital.
So the important thing is that when they are younger, you explain to them that they need to take this medication so that they don't fall sick, so that they can stay healthy. And then once they keep on asking questions and you think they are able to understand what is going on, then you can have a conversation with them. Even though it's the doctors giving the medication and telling you what treatment your child needs, I think it's always important that the parents are involved, because it's your child. No one can understand or speak to your child like you can. So as much as possible, it's important for the parents to be able to disclose to their child what condition they have and what it means. And generally, as a society, we shouldn't stigmatize.
Stigmatization
Let's
pick this call.
Mm-hmm.
Hello, good morning.
Hi. Hello?
Hello, good morning.
Yeah, I'm sorry, I called a different link.
Your name, where are you calling from, please?
Can you hear me? The line is breaking.
Can you call back? Can you turn down the volume?
That's a break. I'm gonna hang up the call back.
Okay,
It's
please
breaking on
call
my
back.
end. I don't know if mine is breaking on.
Okay.
Okay. So, like I was saying, stigmatization is something that could hinder individuals with sickle cell
Yeah.
from reaching out from seeking care. It's a condition that an individual has, but it shouldn't define how we treat the person or limit the ability of an individual to do what they want to do. So, as much as possible, we should let them know that even though they have this condition, they can still do whatever they want to achieve. And once they take
Let's
their
make this
medication,
call. Hello, good morning.
Hello?
Hi, good morning.
Ah,
Hello, good morning.
hello?
We can hear you. Good morning.
There's crazy feedback on your
Okay,
end.
so
Hello?
your name, where are you calling from, please? Hello? I think we're having some issues with our phone lines this morning. Yeah. Talking about stigmatization.
yes. So, if you look at certain individuals, you can't tell that they have sickle cell. Like
No.
the individual you met during
Yeah.
the week.
Yeah.
So, as much as possible, we shouldn't let it limit our interactions with them or limit how we
We relate to them.
exactly
Yeah.
exactly.
As they go to school, how do you think should they be treated differently from their peers, especially when it comes to PE? You know, the child probably enjoys to run, he enjoys doing something. How should we handle them?
So you
Because he
should.
says stress it could also be a trigger.
It could, but physical exercise is good. It's important for everyone. So if they don't feel like they're in pain, if they feel like they can take part in whatever physical activity or PE that is going on, they shouldn't be limited. It's just important that the teachers, the headmistress at the school knows that the child has the condition so that if they have any symptoms of a crisis or an infection, it's known that the child needs to be taken to the hospital. But as much as possible, they should be allowed to do anything that their peers are doing.
Okay. Let's look at treatment.
Okay.
Let's look at the treatment.
Okay. Um, like we said earlier, usually in children, we start from the children. So once we know that a child has sickle cell anemia, they are usually started on micronutrients. This includes folic acid, vitamin C. Usually give them a multivitamin, and then this helps to improve their general wellness. Sorry, it also helps to improve their blood levels. From time to time, some individuals with sickle cell usually they have a baseline anemia, so their hemoglobin levels may not be 11 or 12 like yours and mine, and they are usually fine with it. So if a child with sickle cell comes in and we know that their baseline hemoglobin is 8 or 9, and we've done the lab tests, which we usually do regularly, so we might tell a child with sickle cell that they need to come to the clinic every 3 months or every 4 months, and every time they come, we are looking at certain lab tests. So if we review the lab tests and their baseline hemoglobin, we'll just tell them to continue with their routine medication. If they come in and they are having a crisis because of an infection, we usually give antibiotics to treat the infection. They may need to get a blood transfusion if their hemoglobin levels are falling low. And of course, pain medication is so important because the pain from having a crisis is
It's
devastating.
undescribable.
It's devastating for them. So we usually start with maybe paracetamol, we'll increase to brufen. We may have to add on opioids at a point because it can get that bad. But the important thing is to control their pain, make sure they are well hydrated. If there's an infection, we treat that as well. Okay. And like I said earlier, now there's the option of hydroxyurea. So
That's a
most
new drug.
hydroxyurea is it's an old drug. It's
Okay.
usually used to treat. It's usually used to treat some types of cancer, but in individuals with sickle cell, the dose that is given is much lower than the dose that's used to treat cancer. And we monitor certain labs because once you're on medication, which can have side effects, but has more benefits than side effects, it's important to make sure that the benefits outweigh the risk. So we usually monitor their HB levels. Before we start the medication, we'll do a liver function test to make sure their livers are okay. We'll do a kidney function test to make sure their kidneys are okay. And then every 3 or 4 months, when they come for a review at the clinic, we are looking at their blood levels to make sure that there's no toxicity from the medication. And I've seen a lot of children who are benefiting from hydroxyurea. And I know that soon is going to be something that is available on the National Health Insurance Scheme. So that's a good thing because it's a bit pricey. So for it to be widely available for individuals with sickle cell to have an improved quality of life is it's good news.
Good news. This lady saying, I learned there's a cure for this diagnosis. Is it true?
Yes. So a stem cell transplant can be done, but it's not widely available in especially low to middle income countries. It's available in Ghana, but you have to see a hematologist. It's a process that has to be taken, but yes, cure is possible.
Cure is possible. Thank you so much, Dr. Mills. My time is up. Your last words, encouragement, whatever you want to say to people who are listening, somebody who has sickle cell.
Okay. It's important that you know that your condition does not define you. You may have sickle cell anemia, but you are who you are. You can still achieve whatever you want to achieve. And we are all here, not just as doctors or healthcare workers, but as a society to help you because we are all together in this.
We are all in this together. Thank you so much. Thank
You're
you for
welcome.
coming. Thank you to all those who listened, those who called in to our sponsor, Secure Pills. You decide to Dr. Hildaman Tibiabon and GT Health Connect. My name is Abby. Have a good working day. Bye bye.